Time now for Restoring the Soul of Healthcare from the Help Care Clinic in Austin.
And a pleasure once again to welcome to the program Dr. David Strobel and Lee Aase. Gentlemen, good morning.
Good morning, John.
Yeah,
good to hear from you.
Yep.
Always good to have you, and I always appreciate when we get the topics of the day and kind of following along on a theme that we've been talking about for a while, obviously how healthcare works and kind of how we can tie those two together in dealing with what insurance covers and what it might not, but also what it does. So we're going to start there, and then you've got an important announcement a little bit later.
Yeah, we do. So, as we discussed last week, healthcare is expensive for patients both because of what health insurance covers and also what it doesn't cover. So it doesn't cover typically the diagnostic tests, or at least you have typically a significant deductible. But also the fact that it gets so involved in the day-to-day care really makes everything cost a lot more and adds administrative cost and complexity. I wanted to ask Dr. Dave to talk about that a little bit.
Yeah. So the principle of insurance, is basically to protect you from catastrophic financial costs. So if your house burns down, you got house insurance, and so you won't be homeless for too long. Now, that doesn't mean everything will be great and wonderful, but it keeps you from living on the street and being devastated. And the same thing is true with, auto insurance. If you get in a big car accident, it's like, well, they decide, how to fix your car, and it would be thousands of dollars. And so that's a cost that you can't afford. So you pay a little bit, and then they pay most of it. And all of this has deductibles that you have to pay first, and then out-of-pocket maximum and exclusions and all that kind of thing. And that's all good. The trouble is that if you want your house insurance to be just miserable and really expensive, or if you want your car insurance to be miserable and expensive, then what you need to do is have your house insurance pay for your groceries and your toothbrush, and have your car insurance do your oil changes and pay for your gas. And what will happen is then they'll start saying, well, you drive too far, so you have to pay more. Or you buy too much shrimp, and so we're going to make you fill out a prior authorization form so you can get shrimp. And so then you're using your insurance, which is to protect you from catastrophic costs, to cover everyday costs. And so then pretty soon the insurance company is telling you what kind of underwear you can buy. And that just is not where it needs to be. We need to figure out how to make insurance again so that it actually covers the catastrophic costs and then leaves us alone for the rest of it. So that's kind of what we're talking about today. Lee's got some extra stuff to talk about.
Yeah, the other thing we want to just, if you just think about it, if your auto insurance paid for your oil changes, they would set up networks of preferred maintenance shops that would agree to accept lower payments for the insured drivers, and then for the shops outside the networks, the insured drivers would have to pay an extra fee, and then to make up for the loss of revenue for the insured drivers, the preferred shops would jack up the prices for the other drivers, for the non-insured drivers. And then that had become the new normal. That becomes the starting point for the negotiation next year with the insurance companies. And then as Dr. Strobel was kind of talking, the insurance companies would set up standards to say when you were eligible for an oil change, and if you did the oil change too soon, you'd have to get a prior authorization. And all that paperwork just doesn't make the oil changes any better. It doesn't add anything to the value and just adds to the costs. And so kind of the theme we're saying is restoring the role of health insurance. So we're restoring the soul of healthcare, but we want to restore the role of health insurance, that we believe that the market works, and that when the patient is the customer, and when the patient can be a really good judge of value. And we think that the model that we've been able to have, because we don't have all that additional administrative complexity, can really make it much more affordable and much more convenient. But beyond that, just much more personal, where you don't have an insurance payer in between you and your provider. You're able to just take the time, get the care that you need, what you mutually agree is a reasonable strategy, and you don't have outsiders dictating what you can and can't do.
The only thing I would say is that we don't really believe that the market works. It's completely and abundantly obvious that the market works. So this isn't a matter of belief. It's just facts. And the fact is that we've all been bamboozled into the idea that somebody else has to be in charge of the payments, because otherwise it'll just destroy you. Well, that's the reason that the cost is so high, is because somebody else is in charge of the payments, and we don't let the market work the way it's supposed to. So it's an artificial market, and it makes us fearful of the market that we shouldn't be fearful of.
Okay.
Kind of a psychological operation, if you ask me.
Well, and not to get on to the insurance people themselves, but just as a layperson, I find trying to go through the labyrinth of figuring out in my healthcare what's covered, what's not, the timing of when you have to send in certain things, and they say you missed the deadline. It's become so complicated that it's almost unbearable.
Right.
Yeah.
And it's, insurance companies are not evil. We're not.
Right.
We're not saying that, but, they're a business. And so it's like, well, they look at market opportunities and how could we make use of this and how could we get to this market and how could we increase our holdings there. And so these are methods that have been used to do that. Well, what we needed to do is when that started happening, we needed to say, no, that's a bad idea. We're not going to buy that product. But we got bamboozled into thinking that was the way to do it. And quite frankly, the thing that started all of that was how Medicare and then later medical assistance worked. And so then the insurance companies kind of jumped on that bandwagon after the government had started doing it. So it's just been a big downhill slide in the quality of medical care. Primarily follow the money, and that's where all the truth is. So it's not a matter of dishonesty or that. That's not what we're trying to point out. All industries have this dishonesty and crookedness in them, but that's not really the explanation, and we're not pointing fingers. It's just like, let's just make a better system. That's all.
Yep. Yeah, and that's why we're holding some. We're starting 2 weeks from tonight. We're going to be holding some workshops that we call preparing for open enrollment, because now is the time of year when employees and others have an opportunity, usually, with their health insurance, because health insurance is still necessary to cover those big ticket things, as Dr. Strobel mentioned earlier. But there are ways to choose more wisely to maximize the value that you get and reduce the costs. And so we're holding workshops on 3 consecutive Thursdays, so starting October 27th and November 3rd and November 10th. We're going to be at the Hormel Historic Home, which is just a block from our clinic, but just have a place there where we can help people to better understand their current health care and health insurance costs, what their health insurance options are. So if they've got their open enrollment materials from their workplace, invite them to bring it along. And we'll help them work through that and help them understand how a membership-based direct primary care system like Healthcare Clinic can cover those low-end things, those routine things, the things like the oil changes on your car, and then save insurance for what it should be. And because of that, they'll be able to pick the lower cost options for the insurance side.
Very interesting. For these particular seminars you're doing, would you like a pre-registration or just people drop in?
Yeah, no, absolutely. We're just inviting people to give us a call at 279-2345, at 507-279-2345, or our blog post for today, or in the last couple of days, just called "Preparing for Open Enrollment." We'll have some ads in the Herald as well, where people can, with the link to where they can sign up. So either sign up online or call, because there are 3 rooms at the at the Hormel Historic Home, and we got to know how many of these rooms we need to have for the presentation. So we're starting with one, and then if there's more demand, more interest, we'll see if we can add a room or two.
Very similar to the healthcare clinic as a whole, that as the need arises, you can expand and make sure you get everybody in that needs to talk to you.
That's exactly right.
Right.
And we'll have some workbooks for folks to work through, and so they can really see what the situation is like in their own particular case.
All right, very good. Unfortunately, we're way out of time. Real quick, remind people your phone number, website, and location.
Yeah, we're at healthcare.health is the website. 507-279-2345 is our phone. And we're at 308 4th Avenue Northwest, which is just right between the Hormel Historic Home and St. Augustine's.
All right. As always, great information. A pleasure. Gentlemen, have a great week. We'll talk to you next Thursday.
Well,
thanks, John. See you then.
All right.
Take care.
Bye-bye.